Tiny ears, big troubles understanding ear issues in babies. As a parent, it can be distressing to see your little one in discomfort, especially when it involves their ears. Babies can't tell us what's wrong, so it's up to us to understand the signs and symptoms of ear problems. One of the most common issues is ear infections, often caused by a buildup of fluid behind the eardrum. This can be painful and may cause fever, fussiness, and trouble sleeping. Another common problem is earwax buildup. While earwax is naturally occurring and protects the ear canal, excessive wax can sometimes cause discomfort or even temporary hearing loss. Remember, it's always best to consult with your pediatrician for an accurate diagnosis and treatment plan. They can provide personalized advice and address any concerns you may have. Behind the ache decoding your baby's ear pain. Ear pain in babies can be caused by a variety of factors. As we've discussed, ear infections are a common culprit, often accompanied by symptoms like fever, irritability, and pulling at the ear. Teething is another potential cause of ear pain, especially in younger babies. The pain from emerging teeth can radiate to the ears, causing discomfort. Changes in air pressure, such as during airplane travel or even a car ride up a mountain, can also lead to ear pain. This is due to the eustachian tube, which connects the middle ear to the back of the throat, struggling to equalize pressure. If your baby is experiencing ear pain, it's essential to consult with their doctor to determine the underlying cause and receive appropriate treatment. The telltale rub, why your baby might be tugging those ears. Babies explore the world through touch, and their ears are no exception. While ear pulling or rubbing can be a sign of an ear infection, it's not always a cause for alarm. Babies often discover their ears during playtime and may tug or pull on them as a way of exploring this new sensation. It's a normal part of their development and usually nothing to worry about. However, if your baby is pulling or rubbing their ears excessively, accompanied by other symptoms like fever, irritability, or changes in appetite, it's essential to seek medical advice. Section 4. Battling ear infections, solutions and soothing strategies. Ear infections are a common childhood ailment, and thankfully, there are effective treatments available. Your doctor may recommend antibiotics to clear the infection and pain relievers to manage discomfort. In addition to medical treatment, there are things you can do at home to soothe your baby's ear pain. A warm compress applied to the affected ear can provide relief, as can gently massaging the area around the ear. Over-the-counter pain relievers, such as acetaminophen or ibuprofen, always consult with your doctor for the appropriate dosage, can help manage pain and fever. To prevent future ear infections, it's essential to practice good hygiene. Wash your baby's hands frequently, especially before meals and after playing. Avoid exposing your baby to second-hand smoke, as it can increase the risk of ear infections. Section 5. You've got this. A word of reassurance for concerned parents. Seeing your baby in discomfort can be unsettling, but remember that you're not alone. Ear problems are common in babies and, in most cases, easily treatable. Trust your instincts and don't hesitate to reach out to your pediatrician if you're concerned about your baby's ear health. They are there to provide guidance, support, and reassurance. By staying informed, being proactive, and providing your baby with love and care, you can help them navigate these common childhood ailments and ensure their healthy development.